want to confirm and clarify that I understand correctly that masks will indeed be mandatory in the various healthcare settings that you'd set out for the people who are required to wear them. It's not a recommendation, but it is mandatory. And I'm also wondering, there's groups like Protect Our Province who have called for masks in places like schools as we get back into this season. Why not require masks to be worn in schools as well? But I do really want the clarification on whether masks are mandatory.
It is a requirement, yes. They are mandatory in those settings, in healthcare settings. And we've said this all along. There's different risks in different settings. And we know that people who are most vulnerable, elders and seniors in long-term care, people are in hospital for a variety of reasons, many of whom are immune compromised or older. They're the people who need this protection the most. That's where it makes the most difference in terms of having these layers of protection. We know that all healthcare workers are vaccinated. The majority have a hybrid immunity as well. We're going to step up and get the additional protection from this new vaccine. The new vaccines, influenza is also important. And so it makes, it's really important that we add that extra layer for people who are going in and out of these most high-risk settings. We know that schools have a variety of different parameters. Schools are not the same as a hospital. The most important thing we have in schools is that people stay home when they're sick, that we have provisions for that we've looked at ventilation, that we have a known population. It's not a bunch of different people coming and going like we see in an acute care facility, for example. So there is other measures in place that protect schools, and we've seen that schools are a very safe place for children. It doesn't mean that children don't get respiratory viruses. Of course they do. We know that. We've seen that every year prior to the pandemic, and now we have another one that's in the mix, and that's the SARS-CoV-2 virus. So we need to pay attention to all of the things that we would normally do and need to think about it in terms of all of the respiratory viruses that are out there.
Our next question is from Richard Zussman, Global News. Richard.
Dr. Henry, what is a healthcare setting when it comes to this mask mandate? Does this include family doctors' offices, dentist's office, chiropractors? And you worried at all about conflict between people who have gotten used to not wearing a mask, now being told in some areas they have to put a mask back on?
Yeah, so this is all of the healthcare settings that are health authority owned and operated and run, as well as long-term care homes across the board. We don't have directives that affect physicians and dentists and private practitioners in the community. We do provide guidance and recommendations to them, and I know from my own experience that most dentists' offices have never stopped wearing masks, and they wear them as a part of routine. And so it does include, for example, ambulatory care centers that are connected to a hospital. So it would be waiting rooms, offices, where patients are. So it's patient care areas. So the administrative areas where people are, or cafeteria where people are eating, it won't be mandatory in those settings, but it will be in all of the areas where people who are receiving care or who residents are.
Richard, do you have a follow-up?
Yeah, are you worried at all about conflict existing here? And I also want to ask, and this could lead to conflict as well, the issue around the vaccine mandate in the healthcare system. Can you explain to me why you are not requiring healthcare workers to have a full update of their vaccines in terms of getting every booster? I understand you spoke about some natural immunity and that many workers have already received that. Why not make that a requirement of their employment, that healthcare workers have the full list of available COVID vaccines, including all boosters?
Okay. I thought I tried to explain that, but we'll go back. In terms of conflict, I think most people are reasonable. They understand that when you go to a healthcare setting, that's where people are most at risk. Your loved one may be at risk in those settings, and healthcare workers know that as well. So we have ambassadors who will be there to make sure you have access to a mask and that you wear it appropriately in those settings. So yes, it is a requirement, and yes, I do expect that people will comply with that. It's important. It's important as we have more infections in the community that we do what we need to do to protect those people who are most at risk of having severe illness and frankly from dying from influenza, from COVID, from RSV. So yes, it is important in the healthcare settings, and I appeal to our better natures. We know that this is a relatively uninvasive, unobtrusive thing that is an important measure in healthcare settings, and I encourage everybody to take that point of view and to make sure that you're doing your part. It protects you and it protects those around you.
Our next question is from Mira Bain. Sorry.
The question in terms of the healthcare worker mandate. So the seroprevalence tells us, we know from data that most healthcare workers have had at least one booster, and also from the data that most healthcare workers have hybrid immunity, which means there's a whole combination of different types of immunity that's out there right now in our healthcare workers. And everybody who's working in our public system has that immunity. So we know that any additional requirement is not going to, it's not needed for one thing, but it would, how do I say this? There's so many different permutations and combinations that there's no one single thing that you could do that would make it work for everybody. So we want to have a period of time between boosters and infection and the updated vaccine. So there's just too many combinations, and we know that we have a high level of baseline protection for healthcare workers. So the mandate remains. Anybody new to the system must get vaccinated with this updated vaccine. So if you're unvaccinated, you're coming in for a job in the healthcare system, you get this updated vaccine, and you will be considered protected as we go into this season. So it is a combination. We don't go back to zero when we have time between doses, and we know that we get boosted from being exposed to the virus over time. So that's the rationale behind it. It is the data that shows us that there's a very high level of protection, and as we're going into this season, we want to ensure that we have added protection with this updated vaccine.
Our next question is from Mira Baines, CBC. Mira, go ahead.
Thank you. This question is for Dr. Bonnie Henry. There was a leaked provincial memo, and it says patients, clients, and residents will mask when directed by a healthcare worker or based on personal choice. Why not mandate masks for patients in this regard?
There's a whole bunch of reasons, and partly because residents in long-term care, that's their home, and many people have issues, so we wouldn't expect them to wear a mask all the time in your home. And for patients in healthcare settings, if you come in with a respiratory infection, you'll be asked to put a mask on for sure, and we do that always. But there are reasons why people, because of the health reason that they're seeking care for, might not be able to wear a mask. So the mandate applies to all the healthcare workers, people working in the facility, because they're the people who are there most often and interacting with multiple people over time, as well as visitors. And in terms of residents and patients, it really is dependent on their own clinical condition.
Our next question is from Lisa Yusta, City News 1130. Lisa, go ahead.
Hi there, Dr. Henry. Just for the masking, who will enforce it, and will people be asked to leave if they refuse to put one on at a healthcare setting like a hospital?
Yeah, so I hope it doesn't come to that for most people. I think we're reasonable people. And yes, masking is important for those who are visitors in a hospital. And the ambassadors will be there to screen people for symptoms, to make sure they have access to masks, and we'll be asking people to wear them. We do have security if needed, but I would encourage people to work with people. And we don't go to enforcement first. What we go to is explaining to people the importance of doing this, making sure that they're not putting others at risk, and supporting them in being able to do what we ask them to do.